welcome. Thank you very much for joining us here on Mirror Now. Joining us on the broadcast today is Dr. NK Arora, the Chief of National Technical Advisory Group on Immunization. He's also Executive Director, INCLEN. Thank you very much, sir, for speaking with us here on Mirror Now. I want to understand from you, now, one thing is confirmed that the third wave of COVID is here. Can you tell us, sir, if it is purely driven by the new variant of concern, Omicron, or you think that Delta is still active?
So thank you very much for inviting me. This question is very important because the management and health system preparation for the two are slightly different. So in most part of the country, the upsurge in cases is driven by Omicron. That's what it appears. However, in some northeastern states and in one or two states like West Bengal, Delta is still a significant proportion. But like places like Calcutta, the majority of the cases which are occurring in last few days appear to be Omicron. Here, I would like to clarify that all the positives, COVID positives, cannot be genome sequenced. In a selective manner, genomes are sequenced for the type of virus or the variant of virus, which now show that in most parts of western border of the country, like Maharashtra, Gujarat, Rajasthan, Delhi, Haryana, the whole outbreak is driven by Omicron.
Okay, so you're telling us that Delta is still active, Dr. Arora, in Northeast and West Bengal specifically. But on the other hand, cases are rising quite sharply. For example, in Mumbai, over 20,000 cases are now coming daily. Delhi isn't far behind. For the country overall, we are seeing over 1 lakh cases. So there's Omicron and then there's Delta as well. As you told us, how alarming is the current situation there?
So, as all of us know, that the hospitalization requirements, the oxygen requirements and ICU requirements are much higher for Delta. But overall, so we have to be particularly careful in northeastern parts and in some parts of Bengal where recent upsurge of cases have occurred, because a proportion of these are likely to be Delta. But in rest of the parts, so bulk of 100,000 plus cases we have seen in last 24 hours appear to be Omicron. And as we know from the global experience and our own experience during last 4 weeks, that in most of these individuals, the illness is either mildly symptomatic or asymptomatic. It becomes all right in 3 to 5 days. And the risk of hospitalization is very low, is less than or around 1%, but there is a difference or variation from place to place. But overall, health system, pressure on health system is not there, despite the number of cases increasing so much. So if we go back correspondingly, around 7th April, we had 100,000 cases of Delta primarily. And the kind of bed requirement, kind of oxygen requirement at that time was several times more as compared to what we are seeing today or during last few days. Still, 85 to 90% of the COVID beds are available across the country.
Dr. Arora, now during second wave of COVID, around 4 lakh cases were being reported on a daily basis. What kind of estimate do you have for the third wave? Because in the beginning only, the case count per day has crossed 1 lakh.
So, Heena, this will be very difficult to predict. The number of cases are likely to be high, but what is that number? Very difficult. And it also depends on how various kind of COVID appropriate behavior and containment strategies are adopted across the country. And as you see, rapidly different states and different districts are adopting quickly containment strategies, not going for complete lockdown, but night curfews, weekend curfews, and those kind of strategies are being taken up. This will certainly affect the rapid transmission. So one thing is there, we need to understand clearly that the virus is very much there. Omicron is here, which is highly infectious. The effort now is that we try to reduce the peak in a manner that our health system is able to cope up the requirement of oxygens, hospitalization, and admissions into ICU and ventilator activities. And I think that is the whole philosophy. And the system is several times better prepared now to address all these eventualities. And I think I would like to assure all our viewers that they need not be panicky. There is enough beds for oxygen. Oxygen is no more a problem. Similarly, the number of ventilators, functioning ventilators are being monitored across the country. So we should not have the kind of difficulties we saw around 7th of May when it was 414,000 cases.
Well, that's an encouraging statement, sir, that you're making. People should not panic. The system is ready. Is there any study or estimate, Dr. Arora, that can tell us when we can really expect a peak of the third wave?
So that's what I was trying to say. It will be very difficult because it depends on our corona appropriate behavior. And I think community has come back again to that understanding that the way it is spreading, we need to be very, very careful and follow the mask and hand washing and keeping away from the crowd. I think very rapidly we see that change in the community. Still more needs to be done, but still. The second is this containment strategies which have now been adopted across the country. And third is home isolation. So as soon as somebody has suspected or confirmed COVID infection, people are being asked to have a home containment so that the spread is not wider. And so we can restrict the spread. So it will be very difficult, but coming weeks will be very important. And we have to be constantly working. We have to be very vigilant and ensure that the number of cases do not exceed our handling capacity. And that's the whole effort.
You know, the government, sir, has been constantly saying that the infection with Omicron is milder. Then why are we seeing an increase in hospitalization rates, specifically, say, in cities like Mumbai and Delhi? Why is that happening?
So a national task force on treatment of COVID has issued slightly modified guidelines, I think 2 days ago. And hospitalization guidelines are also part of that. Most of the individuals who have COVID infection these days do not require hospitalization. And that is why the paramount importance is that community should not get panicky, number one. Many of us who are fortunate and can afford to enter into big private hospitals, I would request both the hospital authorities and such people not to get panicky, and so-called preventive hospitalization is not going to help them. In fact, unnecessarily hospitalization can lead to complications. When you are not required to be in the hospital, you can pick up other infections by being in the hospital. So therefore, there is absolutely no need to panic. And only when somebody has breathing difficulty, somebody is having persistent fever for 4 or 5 days, which is not coming down, then only, and you find oxygen concentration or oxygen saturation is coming down, probably these are the conditions which need to be taken care seriously, and on the advice of doctors, admissions may be required.
So you're saying that one should clearly avoid preventive hospitalization and follow the protocol that you've given. If there is fever for about 4 to 5 days only, then you should consider getting yourself admitted in the nearby hospital. Now, talking about vaccines, Dr. Arora, are current vaccines effective against Omicron?
This is most important question. And the answer to that is that primary schedule, 2 doses of vaccine for all our adults is absolutely necessary, because vaccination with both either Covishield or Covaxin, 2 primary schedules for adults, will avoid severe disease and hospitalization to a very, very large extent. So the major advantage is that severity of disease comes down. And fortunately, there are about 25 to 28 vaccines across the world. None of the vaccines is able to prevent reinfection or breakthrough infection after vaccination, or boosters also. But almost all vaccines are working very similarly in terms of minimizing the risk of severe disease and hospitalization. They are almost similar. So we are in a very safe zone in a sense that 91% plus adults have received at least 1 dose. Second, about 67, 68% have received 2 doses. And on top, this is in the background that a very 80% plus individuals have got natural infection. So this hybrid immunity is a good idea as far as risk of hospitalization is concerned. The risk goes down tremendously. But my request to all my viewers will be that those who have got 1 dose, go and get your 2nd dose at the due time. Even if it is delayed, please go and get the 2nd dose. And those who haven't got any dose, they must get. These primary doses are much better than any kind of boosters. And that is why the country has not used the word booster. We are talking about precautionary doses. Those who are at high risk of exposure to the virus, just like our health workers or frontline workers, or those who are likely to have severe disease, those that means more than 60 years and have comorbidities. Otherwise, the primary schedule itself does most of the task, and we are very much there.
Okay. Dr. Arora, but then why is it that during this wave specifically, we are seeing a lot of doctors, healthcare workers testing COVID positive? Is it because of the waning immunity level? Because these were the ones who actually got vaccinated during the first phase when it began last year from 16th of January.
So the doctors, as I said, breakthrough infection is likely to occur in every segment of population. All people, irrespective of their age, and are likely to get reinfection or breakthrough infections. And the same is happening because our health providers, doctors, nurses, and other health providers are repeatedly exposed. So there are a large number of these people who are getting a reinfection or a breakthrough infection. But fortunately, these are mild infections, and within 4 or 5 days, they seem to recover. And even it has been seen that RT-PCR becomes negative, and that's why the quarantine period has been reduced to 7 days after recovery from the illness. And that's what I'm trying to re-emphasize, that none of the vaccines are able to prevent reinfection or breakthrough through infection. But severe disease is very, very important, which is prevented by these.
Okay, so none of the vaccines can really prevent reinfection or breakthrough infection. That is an important point. Dr. Arora, talking about India's vaccination drive, a new phase is underway, sir. As we speak, teenagers in the age group of 15 to 17 are getting the shield against COVID. Now, I want to ask you, is the government only relying on Bharat Biotech's co-vaccine for children, or can we expect more vaccines for children, for teenagers specifically, coming soon that are being considered? What is the target really?
So I would say that today we have two vaccines. One is Covaxin for 2 to 18 years old. The second is vaccines for 12 to 18 years old. 12 to 18 years old vaccine is Zycov-D, but we are first evaluating it in the adults and then started for adolescents. It is the global benchmark that all new vaccines, particularly a new platform like DNA vaccine, we are first using it in adults. It is being rolled out in 7 states in selected districts. Adults will receive it, they will be monitored, and once we are sure about the safety in real program settings, it will be introduced in children also. Now coming to Covaxin, Covaxin has been used. More than 15-16 crore doses have been given in adults, and the data from children is very assuring, and that's why it has been introduced. And we see the enthusiasm. It is very heartening that between 15 and 18 years, parents as well as children are coming forward with great eagerness and enthusiasm. And I think by the end of today, 2 crore children in this age group will get their first dose. Third thing you asked about, what are the other vaccines possibility? So we have Corbavax, Covavax. These are protein subunits and manufactured in India. They are being evaluated in children. Very soon they will be available. Plus mRNA vaccine, which is globally being used in children 5 years onwards. Our Indian mRNA vaccine is also expected by the end of February or somewhere in beginning March. That would. So we have sufficient bouquet of vaccines for children also, very safe vaccines, and some of them have global experience, but almost all of them are being evaluated in our population. And gradually, as the priority has been set for pediatric immunization. Our first priority was 15 to 18 because they are at highest risk of getting severe disease and they behave like adults. And gradually we will go down in a stepwise manner so that children in other age groups are also covered. Our parents are confident and comfortable, and children also participate. These children participate in transmission of virus. That can also be taken care of.
And which is the next age group that you are now looking at to include in the vaccination drive? How soon can we expect vaccination drive for children below the age group of 15 to begin?
So, no, as I said, it will be at the moment, I mean, as I'm saying, there is a broad philosophy that it is 15 to 18, and then gradually year-wise, we will go down as and when the program requirements and epidemiological requirement takes place.
Dr. Arora, will vaccines like Covovax and Corbevax, which have gotten approval that you just spoke about, will they be considered for children?
No. What I'm trying to say is that these vaccines are also under evaluation for children. So they will also be at some time be available for pediatric age groups. At the moment, they have been approved for adults.
But then, Zycov-D, that was the first vaccine that got an approval here in India for children. It was approved last year. How soon can we expect its rollout?
So, as I understand, you might confirm it from the Ministry of Health Program Division. That I think the rollout should have started. And so once that initial batch of 10 million doses is rolled out, we have the feedback. And then we will consider it very strongly for our children also.
Okay. Now I want to talk to you, Dr. Arora, about the issue of booster dose, the much-awaited booster dose. Center has clarified that booster dose or precautionary dose will be the same as the vaccine that one has got, which means that if somebody has got Covishield, 2 doses of Covishield, then the booster will also be Covishield, and likewise for Covaxin. Now it begins from 10th of January. What is the target group that here we are looking at, and why are you not considering mixing and matching of the vaccines?
Yes. Yeah. So those who have received Covaxin initial 2 doses, third dose will be Covaxin. And those who have received 2 doses of Covishield, they will receive Covishield next dose.
And any specific number of people that you are looking to cover? Any targets that you have in booster shot phase?
So vaccine availability is no more a problem. I think we need to be very much clear. Vaccine availability is plenty, and be it Covaxin or Covishield. And we don't see, in first 3 months, I think it about 6 crore individuals will complete their 9 months, because in the first 3 months, those who completed 2 doses were not too many. Actually, the vaccine drive really picked up in June 2021. We know from 21st June onwards, the way rapidly the vaccine distribution, as the access to vaccine increased. So in these initial 3 to 4 months, 5 months, the number of vaccine doses required are not too much. And there is absolutely no difficulty in providing vaccine to our children on one side, and also to the adults who have completed 9 months.
So you're saying that there are enough vaccines, vaccine availability won't really be a problem. But Dr. Arora, some experts are of the view actually that it'll be wiser to use a different vaccine as booster shot to enhance antibody generation. What is your opinion on this?
So it is not view, it is science. So the whole issue is homologous versus heterologous. We should also remember that whenever a different vaccine or vaccine from a different platform is given, the reactogenicity, local pain, fever, etc. increases. So we have done pretty well till so far. The studies are going on for heterologous vaccine, additional vaccine dose. These results will be available from within our country very soon, in next 6-8 weeks. And we have completely evaluated the global data. But our population has one additional feature, and that is most of our population has suffered natural infection. And children is a proxy that about 80-85% of the population have suffered from natural infection. So in this background, we would like to have our own data, and safety is paramount. And we should also understand that this is something which all the decisions which we are taking is driven by scientific evidence and trying to see how things will work in our own country. There was so much pressure that why have we taken 3 to 4 months as interval for Covishield? And we find that things seems to be working very well, and we intend to continue. And at the right time, as and when necessary, we will review these decisions. So no decision is cast in stone. As new evidences emerge, the program will be modified accordingly.
Sir, I also want to ask you about the antiviral drug, which got DCGI's approval, but the government, it seems, is not very happy, and it seems to have sidelined it. Why?
No, it is not being question of being convinced. You are talking about Molnupiravir drug you are talking about. And so there are issues, as DGICMR has very rightly said. There are issues of mutagenesis. That means when a fetus is developing, the drug can interfere with the normal development. And that's why it is also said that if somebody takes that for next 3 months, they should use contraception to avoid having pregnancy. Now, having said that, the issue there, so there are limited conditions, and the data is being reviewed. And for the time being, in the national treatment guidelines, the drug has not been introduced as part of the national treatment protocol.
So now one question is about the guidelines that the government recently issued. Now, for quarantine, your guideline says that if somebody has come in contact with a COVID positive patient, then and the person is asymptomatic, then the person has to be in home quarantine for a few days and has to monitor the health. That's your new guideline. But why is it different for healthcare workers? And here I'm specifically referring to a circular that has been issued by Lady Hardinge College, wherein it mentions that in case a healthcare worker comes in contact with a COVID positive patient, then the healthcare worker has to continue working, has to wear the N95 mask properly and ensure that there is enough distance. So those kind of rules are there. So why are they different for normal people, and for healthcare workers the rules are different?
I think it needs to be interpreted in the right spirit. What the guidelines are saying is that if somebody is asymptomatic, you need to, you might have come in contact, because in the doctors always come in contact with the patients, or those who are working in COVID wards, they are working in. So all the precautions like last year, those precautions have to be taken in. Now, asymptomatic infection is very common. So even in that case, if you are taking precautions in terms of whether it is mask or shield and PPE use, gloves, all those things will have to be used. So because asymptomatic individual, if I start testing everybody, and as this has been very beautifully demonstrated, that when a flight comes, those who are tested and then positive, 70-80% of them are asymptomatic. That means they are carrying the virus. Yeah. So the same thing, those who are working in the hospital, it was happening before also. It is likely to happen now more, and the same kind of precautions will have to be taken.
And last question, Dr. Arora, before we let you go, the way cases are rising, will lockdown be imposed again? Will that be required?
So last time, we have learned during last 2 years of a strategy called smart containment. It doesn't make, so we have to remember Jaan bhi or Jahan bhi, both are important. Health is important, and the life is also important. The life must go on in terms of economy and our daily work. So overall, so far, the strategy is that at district level, sub-district level, containment activities are to be done as was done for Delta. And and that's why these guidelines of home quarantine, isolation, and other things are coming up. And I hope that we should be able to overcome the current upsurge and tsunami of cases in this manner without too much interrupting our livelihoods.
All right, Dr. NK Arora, I appreciate you joining us here on Mirror Now and helping us understand the current situation. Of course, you've given some important piece of information as well. Omicron seems to be milder, and the most important one being that we should avoid preventive hospitalization, because that can impact our health infrastructure badly. Thank you very much, sir, for speaking with us here on Mirror Now.